And basically, this morning they reported on a study that's just been published from Canada. And the reason it's interesting from Canada is because it's a national healthcare system. Everybody is in the same database system. That means they know about everyone. You don't lose anyone because there's nowhere for anyone to go. They gotcha. So you can't, for example, have a problem without them knowing about it. So obviously there's some good features to that and some bad features to that, but the reason it's valuable for this is a surgeon in Canada, a Dr. Christo in Toronto, looked at cancer in patients who had had gastric bypass. And he was able to pull from the national database that they keep in everybody in the province of Ontario, their healthcare system. They pulled out 1,700 patients who had had gastric bypass between 1986 and 2002 or 2004. And then they pulled out people who had the same weight to start with who hadn't had gastric bypass and followed them over those ensuing 15 to 20 years. And during the follow-up, the 1,500 patients or 1,700 patients or so who had had gastric bypass, there were 21 cases of cancer. And that was about 2%. In the control group, there were 487 cancers, which was 8.5%. So their study, and again, this is nice because they can follow thousands of people in their system, suggests that there's something like an 80% decrease in cancer after gastric bypass. They particularly looked at two kinds of cancer. They looked at breast cancer and colon cancer, and they found that they decreased by 85 and 75% roughly. And so pretty exciting news. We think there are a lot of benefits to the surgery, and this is some evidence of its effect on cancer, which of course is pretty exciting as well. Might just take a second and explain how that might work. And first of all, we can talk about breast cancer. Breast cancer in large part is related to how much estrogen a woman has. So higher amounts of estrogen in women are associated with increased rates of breast cancer. And obese women, who I think we talked about on Tuesday, have higher levels of estrogen, have higher rates of breast and endometrial cancer. And so with decreasing your weight and decreasing estrogen levels with the surgery, we would predict there would be a decreased risk in breast and endometrial cancer, and this study seems to confirm that, which is kind of exciting. In colon cancer, we know that increased fat and meat and increased calories in the diet increase the risk of colon cancer. So for example, if you look around the world, you can measure how much red meat or beef countries eat and then how much colon cancer they have. That doesn't prove causation, but basically the more red meat you eat, the higher the risk of colon cancer in the country. So as you may or may not know, Argentina has a lot of cowpokes and cows and buckaroos, and so they have a really high incidence of eating a lot of steak, which sounds pretty good, except along with that, they have the highest incidence of colon cancer of any country in the world. After our surgery, of course, your total intake of beef and meat and hamburgers and things like that goes down, and that might be one of the explanations for the change in the risk in colon cancer in these patients. The other thing is that there's a decreased risk of colon cancer if you eat more fresh fruits and vegetables and whole wheat foods. And if you look at our patients and ask them, and you probably have heard this if you talk to some of our patients, they get a big increase in their desire for fresh fruits and vegetables and salads and things like that. So those two changes alone kind of help us explain why colon cancer might decrease. But it's kind of exciting news. We're interested in it, and it's a little bit of extra good news for those of you who just had surgery or about to, so I thought I'd mention that.